emergency shelter plan that we still kind of convene and do year to year. The YWCA is a partner in that work. Um, we become a place in extreme events, whether it's a hurricane or a pandemic, that kind of becomes the catch-all for anything that's not already established or existing to support people experiencing homelessness. And then the last thing I'll mention is the IRC is one of 4 places in the state of North Carolina that has a PATH team, which is Projects for Assistance in Transition from Homelessness. And so we have an 8-member team that goes out into the streets to feeding programs to wherever people are, and tries to connect with people who aren't engaged in the kind of traditional social service sector, and meet those folks where they are and try to provide the services that they need to try to stabilize the situation for them. So that's it's kind of a nutshell in what we do. We serve about 200 people every day. Um, we've served more than 12,000 unique individuals since our inception in 2009. And we really view ourselves not as an organization, but as a community. So thanks, Stephen.
Thank you, Lindy.
Well, thank you all for inviting me. I am with the YWCA Greensboro. We're a multi-program social justice agency. So we have parenting programs for pregnant and parenting teens. We have a program for adults that are dealing with racial disparities, maternal and child health, that works to decrease infant mortality in the African American community. We also have our Passion and Purse program, which is an entrepreneurship program for folks not traditionally prepared to become entrepreneurs. We have an after school program. And then our homeless services involve our family shelter. We are the only shelter in the area that allows families to define themselves. We serve single women, single men with children. We have served same gender couples with children. We've served trans folks. What we ask is that people show us that they want to function as a family, and if they call themselves a family, then we work with that. We also, all of our work at the YWCA is guided by our empowerment model, and much like Michelle said with the IRC, what that means to us operationally is that we will walk people's journey with them, but we don't define their journey. We encourage them to look at their own dreams and aspirations and where they want to go, and then we're there to support them in doing that. In addition to the family shelter, we have also served as the winter emergency shelter for single women during cold weather. And we've also served with the IRC and others in the white flag effort as we try to keep those folks from freezing on really cold nights. So more recently, we've begun a rapid rehousing program, and we are focusing on families who are working on getting into permanent housing. And oftentimes our families don't kind of get the attention sometimes that single folks get, yet placing one family often impacts multiple individuals. So, so far we're having really great success in getting folks out of shelter directly into permanent housing. In the last couple of months, we've moved 6 families into permanent housing that will be theirs for however long they choose for it to be theirs. So that's kind of who we are.
Thank you, Lindy. Sharnisa.
Hello, everyone. I'm Sharnessa Ridley, and again, I'm the Associate Director here at the Campus Violence Response Center, more affectionately known to some people as CVRC. We are located on campus. We're in the ground floor of the health center. Most people are familiar with the counseling center, which is upstairs from us. The difference between the counseling center and the CVRC, we also have therapists here in addition to our advocates, but the difference is that we see those folks on campus, anyone in the UNCG community, so that's faculty, students, and staff, anyone that has experienced harm, specifically any type of victimization, right? And so we also provide advocacy that can look like accompanying people to the hospital, to your Title IX hearings, to the police station on campus or off campus, and helping provide services, and also being a liaison and connecting folks with resources, especially right now in a time of COVID where students are off campus and a lot of our faculty and staff are all remote. And so they're in their hometowns respectively and may need services from local agencies. And so right now, a big part of our responsibility is being a connector, specifically for our students, and getting them connected with resources in the towns where they are home, where they are due to the relocation for COVID.
Thank you so much. So the next question, I'll leave it open for the panelists to answer as they will, in any order. And this one's really a definitional question, defining the issue of homelessness. There's many ways that individuals may experience housing insecurity or homelessness. Please help us define homelessness and explain the nuances between sheltered, unsheltered, chronic homelessness, as well as broader definitions of homelessness under McKinney-Vento Act. And any of the panelists can go first.
Stephen, I'd like to say that I think for me, one of the things that is often missed is that the homeless community is a large community and is definitely not monolithic. And so I think when we look for one size fits all, one solution for all, we kind of box ourselves in necessary. And there are, as you mentioned, I mean, there's a variety of ways that people are experiencing homelessness. And there's obviously some pretty significant differences between somebody who's unsheltered, completely unsheltered, and somebody who might be couch surfing, but has a roof over their head, or somebody who might be living in a vehicle. And so I think for me, one of the things that becomes very important is to recognize all of those groups of folks, and also the variety of needs that those folks have. There are folks with mental health challenges. There are folks with substance abuse challenges. There are folks with physical challenges, and there's folks who don't have any of those challenges. They just don't have a place to live. So to really look at people as individuals and kind of look at what they need to move them along in their journey, that could be very different than what the person standing beside them might need as they move along.
And I think Lindy's right about that. And I think that the most important thing I think for me to say about this is, we talk a lot when you're in this work that homelessness is an experience. It's not a person, right? And for every human being experiencing it, there's a different set of situations and circumstances happening. And you talk about things like McKinney-Vento, and that's pretty simple, right? Like it says children and youth that lack a fixed, regular, appropriate nighttime place to be. And I think that really is the truth, right? Like that's the most basic way to break it down. We see people, and I know Lindy does, that are homeless for a week, right? Experiencing homelessness for a week. We see people that have been experiencing homelessness for decades. And we see people that, a good example on Veterans Day is to talk about veterans, for example. There are a lot of veterans that, because of the experiences that they had in war, may not choose to go into a shelter, may not choose to do a lot of things like that. And so I think it's easy sometimes for people to say, well, you're choosing homelessness. And I don't think that's the case. I think, though, that everyone that we serve is doing the best that they can in the circumstances that they have. And it's a really, really complex thing. And I think when we try to define it in a really specific pinpoint, you're absolutely going to miss key components of it. So I largely agree with what Lindy said. For every person experiencing homelessness, there's a different definition of what it means to be a person experiencing homelessness. And that's really the crux of it. And I think that people have the right to determine that for themselves, right? Like to say that they want to be identified that way. I think that's problematic. It's problematic that we want to have this definition and say, well, if you fit this box, then you can qualify for these services or these programs or these whatever. When in a lot of instances, no one fits those boxes neatly. It's messy, it's complicated. The longer a person's history is, the more times there are ins and outs of homelessness. I think the biggest thing people talk about is chronic homelessness versus situational homelessness. You know, I would say that any of us on this call could become situationally homeless pretty quickly. You know, and in many instances that will resolve itself with new employment or a new place to live or something going right. And chronic homelessness is a much more complex and deeper issue than that.
Thank you. Let's talk a little bit about some of the causes, the root factors that create situations where people experience periods of homelessness, and in particular, the causes that we see often here locally. What are some of those causes?
I think, this is sometimes territory that has to be treaded lightly, because I think that there are very significant stereotypes that people hold of what causes people to be homeless. And often those stereotypes involve substance abuse or mental health. And certainly those are issues that are significant for a number of people. But we're seeing more and more also generational homelessness and folks um, where we're seeing actually second and third generations of folks who have spent some time living in a shelter. And so their experiences are different than a lot of other people's. Homelessness is an option. It's a state. It's being in a shelter is not to be completely unexpected. So, they may view that a little bit differently than folks who have never been exposed to that situation. Um, I think sometimes we do everybody a disservice, and I appreciate Michelle's separating situational and chronic homelessness, because I think we often do ourselves a disfavor when we talk about, oh, we're all a couple of paychecks away, which is literally true. But I think it also minimizes some of the issues that people are facing. And it's not as simple as, for many people, I'll just get a job and then everything falls into place. That's often not the case. The folks that we see, most of them are multi-system involved. They've been multi-system involved for a long time. They're often folks who had challenges with school, who weren't typical learners and therefore weren't seen as successful there, who've had challenges keeping employment for a variety of reasons. And so it is, there's just a whole lot of different things that bring people there. The other thing related to the generational poverty is, many of us are a couple of paychecks away, but many of us also have options if that were to happen. I've slept on my sister's couch and been welcome to do so. But we see a lot of families that the sister doesn't have a couch either. Or, I could go stay with my mom, but we see people whose parents are also experiencing homelessness, or they're in subsidized housing that prohibits their adult children, from staying with them. So there's just a lot of things that feed into it that I think it's not, again, we try, I think it's tempting to oversimplify, but it's not usually just one thing. I think our staff has come to realize over time that folks don't usually end up in that in our situation because they lost their first job, or because they got evicted one time. Typically it's much more complex than that. It's a whole series, often a generation of events that have led people to where they currently are. And then of course we could go into the whole systemic inequities and how that plays into that, and how that makes some people much more vulnerable than other people.
Well, and I'll dive into to kind of tag onto what Lindy's saying. I think that's really true. Institutional racism is certainly an aspect of that. You look at a city like Greensboro, that's a majority minority city, but our homeless population is disproportionately Black men. That is not an accident. That is because of the way a system was built, and Black men paying the price for the racism that exists in this community. In our community, we have one of the one of the most unstable housing markets as far as affordable housing that we could have. And that's a huge deal. I mean, there are many, many times that we leave vouchers on the table because we can't find safe, decent, affordable housing for folks. The foster care pipeline is a disaster area. We cut children loose when they're 18 years old without natural supports and without ways to stabilize their lives. And they very easily can fall into homelessness without those natural supports. For my community, the LGBTQ plus community, trans people in particular have disproportionately high rates of homelessness as they are young, as do the rest of the LGBTQ community. So I think that those systemic inequities that Lindy's talking about are huge, right? And you can't overlook that. You look at the way we have incarceration in this country, like it is built so that even after you have served time in prison, you never get to go back to square one. You come out at a deficit. And it's really, really hard for people to overcome that. Looking at things like as our homeless population is aging, we are now seeing really tremendous numbers in this community of older folks experiencing homelessness. And when you consider the fact that North Carolina is a state that did not expand Medicaid, we are paying the price for that. The dismantling of the mental health system in North Carolina has cost us dearly in terms of being able to provide people with the supports that would have allowed them to stay in housing. So it is it's the political is personal, right? Like we all know that. And for some of us, that's true in our daily lives. And for some of us, that's true in our work. But a significant amount of policy decisions that have been made at both the state and national level have negatively impacted poor people. And until and unless we as a country and as a community understand that when you raise the floor, you automatically raise the ceiling, we're going to keep seeing these numbers. The IRC was born after the recession of 2008. That's why we came into existence. We are just now beginning to feel the effects of COVID, the economic effects of COVID, the housing effects of COVID, as eviction, moratoriums begin to end, as businesses are unable to recover. And so I think most of us fully expect to see a surge in numbers of people not able to hold it all together, right? Like given the crisis that we're dealing with. So it just like defining homelessness, it's a multi-layered thing. It's a very complex thing, and it is not a one size fits all approach to addressing it. I mean, we talk a lot about the way to end homelessness is really simple, right? It's housing. And I know that we all believe that and we all agree with that, but it is such a complex issue and such a multi-layered issue that it is such a much longer conversation and a much longer way of dismantling the things that have led us to this point. So I think those for me are the primary drivers, certainly in our community and I would argue in the country as a whole.
Sharnessa, are you seeing other factors playing in?
Sure. So there's also lack of transportation, and this is broadly. People end up having to make the decision to be homeless because they can't go back to the other areas of the state because they have no transportation to get back to where they need to be. And so sometimes that happens. Tuition increases and people not having enough financial aid to sometimes cover housing can contribute to the reasons that make them homeless. There are other factors that I think about. Specifically around the breadwinners of the family, and when that person, when there is a separation potentially for domestic violence, or even when there's a divorce of some sort, it can sometimes cause people to be homeless. I wanted to highlight the mental health challenges. I appreciated what Michelle mentioned in terms of resources, because I think language is important. And when we talk about mental health challenges itself is not a precursor for being homeless, right? You're not destined to be homeless because you have mental health challenges. But what will happen is when your community doesn't have the resources available to provide you with support, the likelihood of you becoming homeless increases. And so I know this is primarily primarily focus on a Greensboro, but when we look at a statewide, more particularly in our more rural communities, those numbers are even higher because of the much more insufficient number of resources that are available, everywhere from transportation to affordable housing, and all those things can cause homelessness to rise. I think about folks who have engage in sex work, right? And after engaging in sex work, what does it mean to try to get a place to stay? At some of the rescue ministries that exist, that it can be Christian based, and so sometimes for sex workers that can be off-putting to them. And so now the only way for me to even engage in services and get safe and adequate housing is for me to now get baptized. I know that's extreme, but that's how they see that, right? And so then, because it's another lack of resource for them, there are resources available, but they're not tailored to me. There are resources available, but they're not affirming to my lifestyle. And so now what other options do I have? So those are just a few of the things that come to mind for me.
And
Thank you.
Stephen, I just want to
Yeah.
mention before you move on, because I think it's really important, and you just reminded me with what you were saying, but documentation status is a huge issue within this as well. You know, these are folks that already have a lot of things that are difficult to work through if they're undocumented in this country. And then they are in particular cut off from a myriad of resources that would allow them to remain stable. And that is a huge issue. And then married to that are people, if you think that we don't have people being trafficked in Greensboro and in Guilford County, you're wrong. And there are lots of people who are being trafficked, and that is a huge underground entire system that feeds in and lives off people experiencing trauma and experiencing poverty.
So we've talked about how difficult it is to define, that it's an experience and not a person, that there are many different causes nationally and locally. How big of an issue is this? What is the volume? The state says that according to the point in time count in January of 2019, there were 9,300 people experiencing homelessness on any given day in the state, and 586 in Guilford County. We know these are undercounts. How severe is the volume of this issue? How big is it?
So this may not be a popular thing to say, but I think a pit count isn't worth the paper it's printed on. It's laughable at best. And there are so many things you could come up to me for a pit count, ask me if I'd be willing to participate in it. And if I say no, then you technically can't count me. I mean, it's a complex thing. Over the 6 years that I've been at the IRC, our best estimate is we're underestimating our homeless population by about 40%. If you look at the statistics within Guilford County schools and you compare those to pit counts, they are so far apart, it's not even funny. So there is no really clear number or count for what we're dealing with. And when you look at places like Greensboro, because we have, to your point earlier, so many rural areas around us that have absolutely no resources for people experiencing homelessness, there's a huge transient population that's moving in and out of those places as they need services. And by its very definition, when a person is experiencing homelessness, they lack a permanent address. So you can't say you belong to High Point, or you belong to Rockingham County, or you belong. So it's a moving target, right? And when we underestimate a pit count, there are real consequences for that. When you look at things like census data and we underestimate those numbers, there are real consequences for that. It means that we don't get the resources that we need to appropriately support the population that exists here in this community. And so it's a very difficult issue. It's a very difficult topic. And through all these years, somehow in this country, we haven't found a better way to have an accurate count. I mean, even if you look at our HMIS data and you just count numbers in that, that doesn't account for anybody who isn't connected to the service sector. So it would be an undercount as well. So part of having an invisible community is exactly that. A lot of people are invisible in this and get missed. And they're often the people who require the most in terms of supportive services and time and resources and all of those things. And so I think it's hugely problematic, but I think in a nutshell, I would say at least 40% of an undercount consistently in Guilford County.
I
I'm
think
going to
I
jump
would,
in there if I can, just to define. PIT is point in time. It's for the 30th of January of 2019. It's usually about the same date every year. And there's a team that goes out throughout Guilford County. There's various ways that it's collected, unfortunately. So it's not evenly done across this county, nor from county to county. And then the difference between that number that Michelle pointed out, 586 in Guilford County was the number, but Guilford County Schools estimates homeless youth at 3,247, using a very different definition of homelessness, but something more approximating housing insecurity and sofa surfing and other types of insecure forms of housing that folks are experiencing.
And
I'm
Stephen,
sorry
I
to
think it's
interrupt.
interesting that you talked about the 2019 PIT count,
The 2020
because
is
our
not available.
2020 PIT count is going to be abysmal
Yeah.
and should never be a number that we speak in public.
I wrote to ask for it and couldn't get it. So, and I'm on the data committee, so I don't know what's going on there.
well, and I think part of the, part of the problem is semantics. Part of the problem is definitions, because the point in time count by HUD regulations has a very, very narrow definition of what it means to be homeless. So I think, that number being wrong, I'm not sure how wrong it is following their strict guidelines, but I think the problem is that it's meaningless because that strict guideline does not pick up what the real problem is. And the number we frequently default to with our work is the number that the school system uses. I think that is a much more accurate number. And what we often find, particularly with families, is that folks don't want to be identified. We have families with children who are terrified that if they were identified as experiencing homelessness, that they would lose custody of their children. So, it's not uncommon at all that we run into whole families that are sleeping in cars that aren't on anybody's radar very intentionally because they don't want to be on anybody's radar. And again, that very narrow definition doesn't include people that don't have a permanent address, who are one night away. If whoever's couch they're on tonight says you can't stay here tonight, they will be outside. And those people don't qualify in the point in time count. The folks that are living in abandoned buildings don't necessarily qualify. So I think that it is really in part a definitional problem, but I think that we are all pretty much aware that the count is definitely lower than the problem. And I think that there are very logical reasons for that, and not only is that, not only families that are trying to hang on to their kids, but, folks who may not want to be counted because they've got warrants and they don't want to go to jail, or people who are afraid that if they surface that somebody will force them into some type of treatment that they're not ready to accept yet. So I think it is, as Michelle and other people said it, by definition it's really, really hard to wrap your head around those numbers, but without a doubt the number is way higher than what we're actually counting.
Sharnessa, what about at UNCG? What are you seeing coming through your office in terms of volume? And I know this is a unique year. Not a lot of people. Yeah.
Yeah, no, so very unique year. I will say we've been able to meet the needs from what I can tell based on those who I see. The university has been able to change around some of their housing guidelines in order to allow people to stay on. So when campus closed back in March because of COVID regulations, so many people were housing insecure and didn't have a home to return to. I didn't participate in the admitting of those folks, but I do know there was a process where they could petition the university to say, can I stay longer? And then what we were able to provide is some wraparound services for them to say, well, can you follow up with them often because they're staying on campus? they weren't able to go home. So the university, from what I can tell, were able to meet the needs that way through COVID. To your original question around, how big is the problem and is it going to get worse? I definitely think it's going to get worse potentially, because when we look at we don't know what's going to happen with the economy. We also don't know what's going to happen on the other side of COVID, people trying to get jobs and things. We know that lack of employment is a pathway to homelessness, right? And with so many uncertainties around like the state of the economy and whether or not people are going to be able to find jobs, that does have me concerned. I also think about because the number of folks that are homeless is so large already, I know that the longer you are homeless, the more susceptible you are to experiencing violence, right? So many times of experiencing violence is a level of trauma that contributes back to that mental health cycle we were talking about. After experiencing so much trauma and then being untreated, right, it makes it harder for you to then escape poverty and then also to escape homelessness. If you don't know about ASIC scores, you should look those up and understand I don't work with kids in this role, but again, I've only been at the university since March. My work before that was statewide, so my view of Greensboro is somewhat narrow. I've done statewide policy work much longer, but children that are experiencing violence, right, and those ASIC scores, the more susceptible you are to experiencing violence, it changes other risk factors. It makes you more susceptible to other things like poverty and homelessness. And so until we as a community, as a country, is able to respond to those needs when people experience trauma, whether that be our veterans and PTSD or other issues that are happening, I think it's safe to say that the homelessness is going to grow, unfortunately.
Vanessa brought up the impact of COVID. During the peak, we saw about 14 to 15% unemployment rate, about 30,000 people in Greensboro who were displaced at least temporarily. We're back down to 8.2% in Guilford County as of August, the most recent data that we can get. But we do know that the service sector, hospitality sector, factory settings are hit hardest. People in lower wage jobs have been displaced in disproportionate numbers and are facing housing insecurity. Michelle mentioned the moratoria that will expire. The CDC moratoria expires on December 31st. There's been CARES and HOPE Act money that has been pumped out. Today was the last day to get registered on 211 for HOPE monies. That has been expended. And we're facing potentially a lot of uncertainty come January as to who will remain housed and who will be seeking services. What has been the impact on the services that you've been providing in the past 6 to 8 months? And what do you foresee coming? What preparation is being made for January, February, and thereafter?
So for us, in March, early March, we started having conversations about what to do, right? And we followed CDC and HUD best practice guidance the entire time. We started out with a shelter location. We had 150 people in shelter, in a socially distant shelter. As soon as that guidance changed, we moved that to a hotel shelter system. And for 7 months, we had 150 people in hotels, and we were simultaneously still operating our day center on a daily basis, and managing people that were coming in off the street or showing up otherwise. And Stephen, I think you've known me long enough to know I'm not one to keep my mouth shut. So I think it was an abysmal failure on the part of our county, the way that they chose to respond to this pandemic. They were asleep at the wheel and left the responsibility to service providers without the appropriate things in place at the beginning. It could have been handled better. It should have been handled better. Eventually there was a COVID hotel propped up for people who were asymptomatic or who had symptoms or tested positive. But this was a public health crisis, and it was an epic failure in terms of the way Guilford County chose to respond to it. I've been really vocal about my feelings about that, about what that cost organizations like ours to end up having to carry the load of that. We didn't know in March what we were dealing with. My entire staff got exposed to COVID within the first week of providing shelter. not by a client, by a service provider. And it became clear really quickly that if service providers and organizations start going down, there is no plan B. And then what are we going to do? And I think that people need to recognize, and when you talk about keeping people experiencing homelessness safe during COVID, it's not just for them. When you're dealing with a pandemic, you're talking about community health, and community health is dependent on everyone in that community, particularly people that don't have a place to stay at home, to shelter at home. And so if they're moving about and being exposed and potentially moving a virus around, that's really dangerous. So I'm really grateful for the city stepping in and the choices that they made to ensure that we could secure as many people as we can. Of the 150 people, and it wasn't just 150 people, that was our maximum capacity. As we were able to transition people into more permanent housing options, we backfilled their space with someone who was waiting. So it was a lot more people than that. But at this point today, every single person that came through that program has either been moved into a shelter placement or to an apartment or a housing placement. And it has taken 9 months to do that work. And it has been taxing, doesn't even begin to cover what it's been like. And frankly, we would do it all again and don't regret a single moment of it. And I don't have really any respect for people that, when the people that you make your living on the backs of are facing one of the biggest challenges of their lives, choose to sit back and not act quickly and not act decisively in the best interest of the people most vulnerable in our community. So sorry for the soapbox.
I think, we began sheltering in place in our shelter on March the 15th, and we sheltered in place until just a couple of weeks ago. And sheltering in place more restrictively than even the governor's order for folks, because we are a congregate living situation. And so that meant people only left the property for essential services, and we provided those services. So if people had to get medical treatment, we provided transportation so that they weren't on a city bus, or so that they weren't being exposed to someone else. We made biweekly trips to pick up prescriptions and necessary supplies and those kinds of things. I think, all of the shelters across the county reduced capacity significantly in order to be able to get to 6 feet of social distancing. We're fortunate in it being a family shelter. We have individual rooms, so our capacity we actually increased our capacity. But a lot of the places serving single folks that had bunk beds and people in tighter spaces had to reduce capacity. That's certainly a concern as we move into winter and as we move further into this, because there wasn't enough capacity to start with, and now there's even less capacity. And it's also not lost on me that we're seeing the highest numbers that we've seen since the start of this thing. And we've expended a lot of resources and a lot of efforts. And now we're in a situation where we're going into winter, and this is going to get to be an even bigger issue. I think that we've been really pleased. We've only had one COVID case, and that was an employee. That employee did come to work while they were infected, before they knew they were infected. And we're very pleased that our system worked, that nobody that they came in contact with tested positive. We ended up testing our entire staff and all of our residents, and everybody tested negative. So what that says is that the social distancing, the wearing of masks, the things that we put into place are working. But, as Michelle said, what we also know is that when we had that exposure, we had to quarantine all of our residents, all of our staff for 2 weeks. There is no B team. There is no, if a whole staff goes out, then there's nobody to work. So it's a constant, I think, anxiety and stress of keeping people as safe as you can, and knowing that all it takes is one person who may be asymptomatic, may not even know that they're putting people at risk. I agree with the public health perspective, and I think, I hope that one of the positive things that eventually comes out of this is that I think folks have noticed people a lot more than they ever noticed them before. I think the people on the street that people have passed by and didn't notice, for years, all of a sudden they're noticing them, not necessarily for the right reasons, but they're noticing them in terms of, oh my goodness, could that person be dangerous to me? But I think what it's done is it's shown every community how interrelated we really are, and how we really, it isn't really us and them, because when you come down to a pandemic, it's all us. It's, it doesn't choose people by any specific criteria. So I think that I hope that as we move forward, will help folks see their neighbors a little bit differently than they have. I think the other thing for us has been a very big challenge. And again, situations like this just exacerbate an already broken system. The system is broken. I mean, the mental health system is broken, has been for a long time. And so we encountered, and I know that Michelle's and her folks worked with a lot of folks who just aren't able to shelter in place, who aren't able to physically stay in one place. And I think, again, what it's done is highlighted how deficit we are in truly being able to meet people's needs. Because, we had a woman who thought we were poisoning her through what we were feeding her. And so her need to leave was very real to her. And our need for her not to leave was very real to us. And, what we can put in place and what we have available for people, and it's not just sheltering in place for a pandemic, it's also, White Flag and other shelter. Michelle alluded earlier, we deal with folks in White Flag that have been in prison where if they didn't watch their back every second, their lives were at risk. And so you try to put them in a room with 40 people and they legitimately freak out because they just don't feel safe. And we've seen those people during COVID that aren't comfortable with the options that we've been able to offer. So again, I think what it's highlighted for us is that we still have a lot of work to do to meet individual needs, and that those are real, that it's not a matter of just saying to somebody, shape up, stay in place, that your reality is your reality. And their inability to be able to do what we're asking them to do is very, very real to them. It's not just that they're being difficult, it's that in their world it's dangerous for them. So I think that really paying attention to what are people's needs, and how often do we get in our own way because we build systems rather than wrapping services around people.
Sharnessa, did you want to add something there?
So many great takeaways. Thank you, Michelle and Lindy. I appreciate that. The only I will add in terms of CVRC and what we experienced during COVID, again, I've been here since March, so I've had 2 quarters of reporting. A lot of the numbers from before, when we talk about what our students, particularly, not just faculty and staff, but what our students were saying, would be peer-on-peer victimization of some type, whether it be cyberbullying to some type of intimate partner violence to rape. What we're now getting more exposed to is going to be inter-family violence, right? Because folks are back at home and they're having to return back to environments that coming to college was their escape from, right? And so knowing that we have students on the line, I just want to say, like, that fact alone can be triggering to anybody. So if you're on this call and you're experiencing any type of violence at home, please know that you can definitely reach out to me. And so we provide services to all the community, and it doesn't have to be because you experience crime or victimization on campus, but because you are part of this community, we're available to serve. And I think COVID gave us an opportunity to learn more about what students go through at home because they were quarantining at home. And we had to get creative in how you give people outlets, because before, a person going through trauma, you tell them, don't stay by yourself. Well, that's the absolute opposite of what COVID told us to do, right? You needed to stay in that place. You needed to stay home. So how do you balance providing services and being trauma informed with knowing that people may be in a potentially unsafe place? When you can't find options because the local resources are so limited, you have students who are saying, I'm safe, but I'm staying at a different house every other night because the house I had to leave from campus and come back to wasn't safe, right? Like, I was excited to leave my father when I went away to college, and now I have to come back and stay under his roof, and it's not safe, right? And so it just, for us, COVID, shined a light on a lot of things that we knew was there, but it gave us the opportunity to kind of, tweak our service delivery to make better use of our time to meet their needs.
Thank you. Let's open up for about 5 minutes of questions. Does anybody have a question that they'd like to ask? They can unmute or put it into the chat. Emily, you're still muted.
Sorry about that. I received a question. Is there a single policy that, if passed, would address a significant portion of the homeless population? And the same goes for, are there policies that UNCG could pass that could reduce homelessness among UNCG students?
I don't know that there is a single policy that in terms of statewide. One thing that's recently happening that I'm learning that I've started to appreciate. So North Carolina has 100 counties, and there are currently 78-ish local service providers that serve those 100 counties, and those folks either give services for domestic violence or sexual assault services that serve those 100 counties. And so those programs are all grant funded. Recently, what's happened, those grants have not been able to, they haven't been able to spend all the money that they would have over the year because of COVID. So what some of the state funders, DPS and Council for Women, what they have started to do very recently is they've reverted those funds, and they're giving currently the two statewide coalitions, so North Carolina Coalition Against Sexual Assault and North Carolina Domestic Violence Coalition, giving them the option to provide funds to anyone impacted by sexual assault. So that is an example of, I think, a policy that's really meeting the need of the people and not just systems, because generally what happens is these grant funds are only available to organizations. So because I'm an organization with a 501(c)(3) status, I can apply for this funding. Now, if you go to, like, for example, NC CASA's Twitter page or their Instagram page right now, they're saying, are you a person that has been impacted by sexual violence and have been impacted by COVID? You can apply to us for some type of financial relief, right? And so when we put money in people's hands, that increases their ability to sustain themselves, which in turn we can argue can help them with homelessness. So I think the policy that needs to happen, whether or not it is one single policy or multiple policies, will be a little bit about what Lindsay said, which is building more around the services and not around the agency. And that isn't, for me, a really good example of how do you meet the needs of the people and not just give money to the organizations. So I think all policy development just needs to really consider that.
I would say, Stephen, I saw you just put up universal basic income, and that was one of the things I was about to say. And then on a more like succinct level, socialism as a housing model is also a policy answer. And, and I don't think a dirty word. And people get really ripped out of the frame, and I'll get phone calls about having just said that, but it's true, right? Like, if you really act in a collective manner, we could absolutely end homelessness. We could absolutely end the economic inequities of employment and things like that. I don't see that as a policy solution we're going to get anytime soon. But those, I think, are real things that if people could take away the images that like renders in their head and really think through what things like universal basic income, think through things like collective housing, think through things like socialist housing models. There are lots of things that we could do policy wise that would make a huge impact quickly, right? Like, it won't answer all of the additional services needs and things like that. That infrastructure needs to be built better, but those things are real.
Yeah, I don't think it's one policy, but I think there's a lot of policies, and some of those policies would be much easier and quicker to implement than others. And there are some that I think could pretty quickly make a huge difference. And some of those are zoning issues. Some of those are there are things, creative ways to have housing for more people, that all it would require is a change in zoning that doesn't even cost money. So I think that again, I think we hamstring ourselves. We just don't get creative. We don't think outside the box. We don't look at it. Obviously, Medicaid expansion and universal health care is as important as universal income. I mean, you know, the numbers of people that we see that are in the situations that they're in because they have chronic illnesses that they can't get treatment for, they can't get medications that they need, they have mental health challenges and they can't get their medication or they can't get appropriate service. You know, those things could be, I mean, Medicaid expansion in the state of North Carolina could take care of a whole lot of ills pretty quickly. My father back in the 60s worked in an anti-poverty program in Mississippi, and he wears his socialist label pretty proudly, as do I. And you know, he just for the heck of it one day sat in his office and calculated if he liquidated his entire budget, how big of a check could he write to everybody that he was serving? And it was a very substantial check. And for most of those people, it would have solved their problem. But the flip side of that is that the service industry is also a huge employer and a huge source of income for a lot of people. And what he realized is he could write all those people a check, but then he would also put a whole bunch of people out of work that were being paid to serve those folks. So it does get complicated, but I think again, we box ourselves in unfairly and unnecessarily by not looking at how we can be creative. You know, something as simple as granny flats. You know, it's not, it doesn't cost a lot. You know, my mother lives in California. My grandmother lived the last 10 years of her life in a converted garage in the backyard of my mother's house. That kept her from being in a more restrictive place and a place that would have been more expensive. And it was family and it was, you know, but we have, again, we kind of make up stuff that then we say, oh, we can't do that because we made up something that says we can't do it. But we can unmake that stuff up too.
That was a great concluding question. What is the silver bullet? There isn't one. It's a combination of many different things. I want to thank our guests very much for joining us. If you can do a virtual hand clap or a real one, that would be appreciated for them. And I'll turn things back over to Emily.
Yes, thank you so much, everyone, for coming out tonight, showing up virtually tonight. The panelists, you all, thank you so much. That was an incredible discussion, and I think I can speak for all of us that we learned a lot, not only about the issues at hand, but about what's happening locally and at UNCG. So thank you again, and thank you, Dr. Sills, for asking great questions and for being a great moderator. Thank you so much, everyone. Have a great night.
Thank you.
Bye.